Okay. So I have three topics. It's going to be abdominal illness and injury, hypothermia, and then heat illness. So first off, I'll start with hypothermia and other cold injuries that are applicable for what we do. So hypothermia is when the core temperature of the body um, is too cool for like your brain and your muscles to act as they should. So you start making bad decisions, your body starts compensating in ways that are not good, and ultimately it's a slow decline until um, possibly death. Hypothermia is really common after like someone falls into water and is wearing wet clothes. Additionally, wind does not help that, and they're just unable to regain their body heat. And so signs and symptoms of hypothermia are cold stress. So that's like shivering, and like your body, you're just cold. And you're having sensations of being cold but your mental status is still normal. And then mild hypothermia is impaired ability to perform complex tasks. And like you have fine motor shivering, so like your hands are cold, your fine motor skills aren't great. You have a little bit of apathy, so like not really caring about things, and slurred speech and the umbles. So like you're not speaking super well, but you're shivering, which is a good sign. Moderate is uncontrollable and violent shivering. You can barely speak. You're stumbling, and you are starting to have an altered mental status. And so that's how you really know that you're getting into moderate hypothermia. And then severe is like your body is holding on for dear life. Your shivering has stopped. Your muscles are rigid. You have a decreased mental status, and you're trending towards unresponsiveness. Your pulse has slowed down. Your respiratory rate has also slowed down and almost become hard to detect. And possible ventricular fibrillation, which is related to your heart. And when you're going into VFib, that is not good, and possible cardiac arrest. And so, how do we treat hybrid? I mean, how do we treat hypothermia as guides? So first off, we want to change the environment. We want to find the patient shelter, whether that be like in a tree well or setting up a tarp in a tent. You want to get them out of the wind. Wind is one of the best ways for heat loss. You want to insulate the patient. So whether that be getting them in dry clothes, first off, you want to get them into layers. Use your layering system by using like a fleece, then a puffy, and then of course like a rain jacket on top of that to prevent wind. Dampness in clothing can be subtle, like it can just be from their sweat throughout the day. Like it doesn't have to be soaking wet. You want to insulate other areas that you don't think about as much, like the head, the neck, the hands, and the feet. And then consider using a hypo wrap, which I'll show in just a second. Also, things to think about is like when they're sitting, they're losing heat to the ground. So like you want to put them on like a sleeping pad with a sleeping bag as well. You can add heat packs or hot water bottles. That's a great way to warm patients up, as well as like even skin to skin talk contact, if like setting up your stove is an option. You want to add calories. Food is one of the best ways to also like get their energy moving, and energy is heat. And so you want to encourage them to give them a meal, give sweet, warm, non-caffeinated or non-alcoholic liquids. So the caffeine kind of just throws off the metabolic system a little bit. And same with alcohol, you don't want to do that, even though it'll give a sensation of being warm on their face and things. You'll lose more heat than you gain. Um, if your patient is alert and like mentally aware, you can use exercise to get them to have heat. Most of the time, they're not really going to want to do that. And psychological first aid is also important. So, like, that is an option, but not always the best. Um, Hypothermia can induce shock. So, you want to be aware of that and maintain temperature in sh trauma patients. So, like, if you have a patient that is in shock or is like teetering unresponsiveness, you want to combat hypothermia earlier than later. And then patients may require 24 hours of rest, hydration, and food intake to recover. When you're combating hypothermia, or if you're like getting to moderate and severe, like you're going to be completely exhausted after overcoming it. especially if you're still in the field. So yeah, treatment, handle gently and keep the patient as horizontal as possible. This is to encourage blood flow to go everywhere. Administer warm, humidified oxygen if available. That's probably not going to happen. That's more of a search and rescue thing. Hypo wrap is great, especially if they're moderate to severe, which I'll show you in just a second. Heat packs or water bottles, avoid walking or standing, and add calories. So these are all things that I covered previously. That's kind of how you would intervene as a guide. Field warming for severe specifically, which like we as guides like a severe is an immediate evac, but field warming is unrealistic. Um, the goal of treatment is holding their temperature where they're at. So basically, you're not hoping for recovery, you're hoping to maintain their where they're at. Um, do not do chest compressions for CPR on a hypothermic patient unless you know that they don't have a pulse. Sometimes with a hypothermic patient, their pulse can drop down to like very scary beats per minute. But you still don't want to do chest compressions on an alive person. And then if you do have a hypothermic patient that you do end up doing CPR on, you can go past the 30-minute threshold. Actually, like the hypothermic quality, like them being that cold actually like can preserve certain things in like the cardiovascular system. So like you can do CPR longer than 30 minutes. That's a very niche, probably won't happen, but yeah. Rapidly evacuate a patient um, who does not respond to warming efforts, even if it's like mild. If you cannot get them warm, evac them. Um, Moderate to severe, I would say evac as well. But the main thing is like trend lines. If they're not getting better, you need to evac because it can get very bad very quick. Any questions on hypothermia? All right, now I'll move into hypo-wrap. Basically, we know that it is basically a sleeping pad, um, and then sleeping bag around them with layers. The more layers, the better. Insulate their head, their hands, everything like that. Throw in a hot water bottle or a hand warmer, whatever you got, and then insulate them with a tarp. Whether that be like the tarp that we carry as guides or the rain fly from a tent, etc. And keep them warm with that. You can also put another body in the hyper wrap with them. That would make transporting it a lot harder. If a search and rescue team came in with a litter, they're going to want only one person in there. So if you're thinking like short term, only do them in the hyper wrap. Okay, next up, we're going to do heat illness. Um, So, heat exhaustion first. Heat exhaustion is basically a person who is unable to cope with the elements. It's just them being exhausted by the heat or being warm, and their body not being able to handle that. It's pretty vague. Like heat exhaustion is like a pretty wide scoping term. But signs and symptoms of heat exhaustion are fatigue, nausea, and vomiting, loss of appetite, muscle cramps, a change in LOR, which is level of responsiveness, so dizziness or fainting. Heart rate and respiratory rate are going to be increased. And then their skin is going to be pale, cool, and clammy, or even slightly flushed. And that's like, you might be thinking, oh, a hot person, when they run, they're going to be red. This is like long term, like they're eventually going to get pale, cool, and clammy. Treatment principles for heat exhaustion are rest, avoid further heat stress, hydrate, treat exercise associated muscle cramps with gentle stretching. And then if they're not improving, we'll evacuate. Most of the time, heat exhaustion, they will improve. And like there's a you could very well see like very mild heat exhaustion this summer. I think it's something that we should definitely be prepared for. Um, So yeah, how do we avoid this? Taking like strategic breaks, um, being aware of like how your clients are doing. Um, and just being extra watchful towards that. Distributing pack weight if necessary. Breaks, shade, and taking breaks while you're in shade is super important. Pushing water, as well as like exposing skin to water. So like if they need to wash their face with water, put water like on their hands and extremities. Like that's a great way to do it. Um, Next, heat stroke. So heat stroke is more extreme than heat exhaustion. It's a life-threatening emergency. Patent, this means that they have exaggerated heat production and they are not being able to cool themselves appropriately, whether that be like their blood vessels expanding or sweating, whatever they're doing to combat the heat is not enough. Um, so this could lead to classic heat stroke, which is from heat, or exertional heat stroke. That's from like pushing really hard and pushing your limits, muscular wise, and other stuff like that. Altered mental status is the distinguishing feature. So like heat exhaustion, there's still like LOR at least times three. Um, Whereas heat stroke, they're not very responsive. So the signs and symptoms is a change in LOR. This can lead to like disorientation, irritability, combativeness, or even unresponsiveness. Hallucinations and seizures, ataxia, heart rate and respiratory rate increased. Their skin condition is going to be hot, color, and moisture can vary, so you kind of have to watch on that. But temp for body temperature is going to be above 104 degrees. That said, like you're not going to have a way to measure this in the field. So your main sign for this is going to be LOR. Are they responsive, awake, oriented? And we'll go over how to measure LOR. It's basically your name, where you are, what you are doing, and who you're with, and what day is it as well. Treatment principles. So like heat stroke, you're going to do aggressive cooling. So whether you can find like an alpine lake, get them sat in a stream bed, spray with water, fan the patient. If you put them with water, think about like their responsiveness, like don't submerge them. You want to protect the airway. But yeah, you're cooling them with any way you can. Like if you can get snow, you can get snow. Like things like that. And then that's a rapid evac. Emphasis on the rapid, like you're getting them out as fast as you possibly can. But at the same time, they're not going to be able to do much. So think about that. Rhabdomyolysis is the next topic we're going to cover. That's basically your muscle being broken down so much that it's not able to recover and release. This can get into like this muscle breakdown can get into your bloodstream, which ultimately can cause kidney and heart damage. Basically, it's mostly muscular stress. This signs and symptoms for this will be muscle cramps, aches or pains, inability to complete a workout routine, Coca-Cola covered urine. Additionally, like that muscle will be pretty immobile. So, like for example, if it was like your bicep, like you wouldn't be able to extend all the way. Um, Basically, like hydrate them as much as you possibly can. A lot of the times rhabdo is induced because of a lack of hydration in electrolytes. Remove them from heat or exercise stress, and most likely, if it's a leg, you're probably gonna have to evacuate. That said, rhabdo is, if treated, it's very preventable with hydration. Ultimately, for evacuation, when it comes to heat, you're going to evacuate anybody who's just unable to cope and recover from the heat. So, like if someone is hiking and you finally make it to camp and it's 6 hours later and they're not recovering from that heat, like you should be thinking along with your guide partner, like, what am I going to do in this scenario? Um, Rapidly evac all patients who have altered mental status. Um, so if you have a client who I would say is AO3 for me would be the threshold. So yeah, I think that's a call that you're gonna have to make with your guide partner. But like a little bit of dizziness is that's normal, but like when they're like forgetting certain things, that's when you need to evac them. All right. Last topic I'm going to cover is abdominal illnesses. This is a very wide topic, as I'm sure you can tell. It basically means anything affecting your stomach, intestines, or other organs in a wilderness context. So that could be from trauma, that could be from sickness, that could be from food poisoning. Like it's a very wide range. They need to be taken seriously because we, as guides or as like wilderness first aid givers, like we don't have much way of knowing what's going on. Even if you know like the anatomy of someone and the quadrants and what's going on in each, like you truly don't know what's going on without further medical help. But here are some, I'm just going to list some things that we're going to kind of go over, but things that could be at play. Puncture, blunt trauma. That's actually probably one of the more common ones. Aortic aneurysm, ectopic pregnancy, kidney stones, fecal impaction, which is basically when fecal matter gets where it's not supposed to be. Gallstones, hernias, testicular torsion, ovarian torsion, appendicitis, pancreatitis, peri peritonitis. I always struggle saying that. Gastroenteritis, which is basically stomach flu. The good news is, like, as guides, I don't want y'all to be overwhelmed. You're not expected to know the ins and outs of every single one of these, so don't be overwhelmed. Um, we're going to go over abdominal illnesses and what to look for as a whole. Um, so, but I'm going to go over interventions for each one of these, or a couple of them, the ones that you're going to see. So, stomach flu, food poisoning, and traveler's diarrhea. So, gastroenteritis, food poisoning, and traveler's diarrhea. All three of them, very common symptoms and very common treatments, or similar. So, symptoms for those are going to be like, um, well, first let's go over what causes them. Gastroenteritis, the causes are viruses or bacteria. So, like if y'all were, if they were not treating water properly or things like that. Food poisoning, the causes for that are bacteria in your food, you not cooking it well enough, um, or possibly viral things like norovirus. And the traveler's diarrhea, the causes are ingestion of contaminated food or water. So kind of the same thing. Symptoms, nausea, vomiting, diarrhea, abdominal cramps, sometimes fever when it comes to food poisoning, and then um, your traveler's diarrhea is just going to be more diarrhea than the normal event diarrhea. Your risks for all of these, because you're like vomiting or diarrheaing, like having so much, your one of your major risks is going to be dehydration and electrolyte imbalance, because you're just you can't hold any fluids in, and especially if someone's coming from a lower elevation where they're already a little dehydrated, like you need to be watching that. Additionally, other risks from that dehydration is shock. That's a big thing. And then also like just weakness when they're feeling crappy, they're going to have an altered state, not be hiking as well, not be as smart when making decisions that can lead to other risks. Treatments are going to be hydration. And so also giving like salts, or other electrolyte things as well. For stomach flu, we're going to want to give pain management. So like the over-the-counter medications that we carry, like acetaminophen, could really help. We don't we want to avoid ibuprofen when we're thinking abdominal injuries, because that could increase grease for bleeding. So if you're there having abdominal pain, maybe more like acetaminophen. Um, Positioning, so have them lie down in a comfortable position. And then also with abdominal issues, we want to be taking vital signs often. Um, and you also want to be keeping an eye on pulse or vital signs, respiration, level of consciousness, and then also watching for signs of shock, mainly from the dehydration. Um, does anybody have any questions on these three? All right, next is appendicitis. And so this is when your appendix is basically at chance of rupturing and is very irritated. Um, the patient will experience pain in their lower right quadrant. They'll have nausea, vomiting, fever, pain upon palpation, which is basically like you palpating the abdomen. Um, Risks is a rupture, which could be life-threatening. Um, and then this is like in a medical emergency, we're immediately evacuating this. It's very painful. They'll let you know that. And so it'll be pretty obvious that they need to be evac, and you don't necessarily need to know it's appendicitis, but think appendicitis when you specifically think lower right quadrant. Um, One thing is for abdominal pain, we don't want to apply heat. Some people might want like a warm compress. We don't want to do that. That could cause the appendix to rupture faster. You can administer pain relief for this. So like acetaminophen is a good option. All right, bowel obstruction. This will be severe cramping, bloating, inability to pass gas or stool, and vomiting. Risks include like necrosis of the bowel, which basically is not good. That's your bowel starting to like die, I think. But also just like strangulation of the bowel. Risks basically is like horrible, horrible pain. Um, your treatments for this is you're going to want to minimize their food intake. Do not allow the patient to eat or drink. Drinking as well could worsen the condition. You want to administer pain relief carefully, and then this is also an immediate evac. All of these, when you're like trying to teeter the line of like, oh my gosh, should I immediately evac? Like, it'll be the patient will be incredibly, incredibly uncomfortable. And so, as long as you consult with your guide partner, you'll be able to tell. Abdominal trauma, so this could be like blunt trauma or like penetration of like a tree or falls, accidents, animal bites, stuff like that. Symptoms of this will be pain, tenderness, bruising, swelling, and possibly internal bleeding. The risks could be organ damage, internal bleeding, and then if they're bleeding out too much, shock. First off, we want to stop bleeding when we do this through applying direct pressure. And you've also learned how to do this in one of your other sections. You want to immobilize. So you want to use a sterile dressing or gauze to cover the wound. And then if there's suggested or suspected internal injury, you want to have them not move very much. And they're not going to want to move. They're going to be uncomfortable anyway. You want to monitor for shock, raising their feet if possible to encourage more blood to be towards their central organs. And then you're going to want to evacuate, most likely. Yes, you're going to want to evacuate. And then another one that is very possible is a urinary tract infection. And symptoms of this will be like painful urination, abdominal discomfort, frequent urge to urinate, and sometimes fever. And then risk for this is kidney infection and sepsis if it goes untreated. Your treatments for this is hydration, rest, antibiotics, which Kate, I need to go over with you. I don't remember if we carry antibiotics or not. And then evacuation. So for evacuation for a UTI, I would say it depends on at what point in the trip they're getting a UTI. If it's day 3 on a 4 day, I don't think I would probably evacuate. They're going to be a little uncomfortable, but you could totally get out of there. If it's day 1 and they're disclosing to you that they have a UTI, I would possibly hike them out. Here's some general rules for all abdominal illnesses. I know that I just threw a lot at you. Um, but I want to go over like some general things that you want to keep in mind. Hydration, unless you think that they have a bowel obstruction, um, you want to give them hydration, encourage fluids, because in all of these, like dehydration is a possible thing, and that could lead to shock. And so you want to be really careful, in that. Pain management, you want to keep them comfortable as much as possible. Goes into psychological first aid and being a good guide and taking care of them as a person. You want to keep them comfortable. Acetaminophen is a great option for abdominal illness. Ibuprofen, we kind of want to stay away from, which you're going to want to be aware of because a lot of people, when they feel ill, they're immediately, can I have ibuprofen? And so acetaminophen for abdominal injuries. Keep that in mind. Positioning, you want to keep them comfortable. And then abdominal injuries, I mentioned this previously, but you always want to monitor vital signs, which is pulse, respiration rate, level of responsiveness, and then um, also looking for signs of shock. And then also because we carry the blood pressure monitor, we can also monitor that. Um, Real quick, I'll show y'all anatomy of the stomach and explain some of the quadrants. And so like upper right quadrant, I would be thinking like gallbladder, or possibly some kidney infection. Um, Upper left, I'm thinking more of like, did they rupture their spleen? Is the pancreas okay? Right lower quadrant, we mentioned appendix. Also for women, like be thinking of the ovaries when you're in the lower quadrants. Um, and then lower left quadrant, think of like the ovary as well, or like for also men, think of like testicular torsion for the lower quadrants. But I think you'll probably know when that happens. Um, and so, yeah. So here are some questions that we want to be thinking of as we're gathering a mechanism of injury and doing our patient assessment system for a patient when it comes to abdominal illness. We want to think of OPQRST. And so O is going to be onset. How did this pain start? Was it sudden or gradual? P, so provokes or palliates. So like what makes the complaint better or worse? What is provoking you and what's causing the pain, and then what's making it worse or what makes it better? Quality. What words describe the pain? Radiation or region. Does the pain thrash out to other parts of the body, or is it located in one specific region? Where is the pain starting from? And where is it moving? Where has it moved in the last 30 minutes? Think of that. Severity. How bad is this pain? How um, able or unable are you to walk, to use the bathroom, to bend down, things like that, to eat. And then like rating it on a scale of 1 to 10. And then time and trend. How long has this been going on? Is it getting better or worse? Um, and then ultimately, like these not only provide you with the information needed if you were doing a rapid evac to do a SOAP note, but also these questions and then them being asked over and over again can help you make a decision on an evac. Some other things that you want to be thinking of are like, is there blood? Are they having a fever? Are there other patients that are having the same symptoms as them? Um, that could probably hint towards like contaminated food or water. Um, Nausea, vomiting, and diarrhea. Any changes in their diet or water. Um, or is your patient slipping into shock? Was there something that caused a big amount of stress? Is your client having their menstrual cycle? Have they had similar pain like this before? Is this something that they've experienced before? And then during the physical exam, you want to palpate and feel for that, as well as like rigidity or guarding. If they're like reacting very intensely to you pressing somewhere, like that's a sign. Distension, so that's like misshaping of something, and it's like sticking out. Bruising is a big sign, open wounds and scars. EVAC guidelines. So let's talk about like what you should be thinking when it comes to abdominal illness. If it's more than a simple UTI, which we talked about, I would maybe evac them on day one, but I probably wouldn't later in the trip. If it's more than just like they're gassy and have like a mild stomach flu, or it's more than a UTI, um, we're evacing that. Especially you could do a trend line, but I would be more conservative. If it's not getting better, I'm for abdominal illness more towards an evac. If the pain is not resolved in 24 hours, we're evacing that. If the patient for women's trips or co-ed, not co-ed, couple strips, if y'all do the patient assessment and it comes up that like the patient might be pregnant, we're going to evac that. Spiking fever or bloody poop, we're going to evac for that. And then if they're unable to keep fluids down for 24 hours, um, we're evacing that. So basically, any evac is happening if pain is not resolving in 24 hours. For rapid evac, we're rapid evacing anything that is signaling towards shock, constant and miserable pain for 12 hours, a fever greater than 102, which you're not going to be able to tell. Blood and urine, vomit, or poop, we're going to evac for that. And then major discomfort that inhibits their ability to hike and participate. So like if they're at the point where like you're having to take a 0 day and they're just miserable, like evac them. Yeah. So ultimately, like abdominal illnesses can be a little scary because they're so vague and you don't really know what's going on a lot of the times. I would definitely recommend really memorizing or like writing down OPQRST. Those questions are going to help you do your job in telling base camp or search and rescue team what's going on. Um, that information is critical. You diagnosing exactly what's going on is not critical to helping someone and possibly saving a life. You giving the information to search and rescue teams or to base camp, that is different. That could save a life and makes a massive difference. And so, OPQRST and those questions and doing a successful patient assessment is extremely, extremely important. Um, and then you can include what you think is happening in your SOAP note, but what's really more important than that is the answers to their questions, and trend lines and monitoring vitals and taking those and then documenting them so that you don't just like, oh, vitals are good. Like we need specific numbers. And so that is abdominal illness. One that I did not cover was a couple that I did not cover was ectopic pregnancy, testicular torsion, and ovarian torsion. Um, and so I'm going to cover those real quick because I want to add those to my lesson plan. Um, Give me just one second. Okay. I feel like, yeah, I want to add these. Sorry, this is not very organized. So basically, it's like when a fertilized egg starts to grow outside of the uterus. It's it can be scary. And so the early signs of this are like the same, a lot of times the same as like a normal pregnancy, missed period, positive pregnancy test, mild vaginal bleeding, and pelvic pain. What really is significant is oftentimes that pelvic pain is one-sided. Worsening signs are going to lead to like sharp and stabbing abdominal pelvic pain. Um, and then like it could even lead to like shoulder pain from like the blood. If there is internal bleeding, like your diaphragm is going to be um, irritated, and then weakness or dizziness or fainting, and then like rectal pressure and like the urge to want to go to the bathroom. We already know that like if you think that the person might be pregnant, you want to not evacuate them, but like get them out so that they can seek care for that. But ectopic pregnancies are even more of a risk. That could lead to like lots of internal bleeding and shock. And so that's just something that you should be aware of as a woman's guide, especially. Um, and then testicular torsion is basically when the testicles get twisted. Um, it's extremely, extremely painful. Like their trip is going to be over. Additionally, like It can lead to permanent damage or loss of a testicle, and like that's not something that we want to have a client go through. And so this is also a rapid evacuation. It'll be one-sided pain of the testicle, or one testicle, swelling of the scrotum, redness or tenderness, abdominal pain, nausea and vomiting, a testicle that's not placed where it's supposed to be. Um, and so yeah, we're rapid evacing for this. Don't wait to see if it gets better. This is an emergency, and we want to like protect their bodily functions of like what their testicles do. And then lastly, I want to go over ovarian portion. I need to add these to my lesson plan. I didn't have them in there. This one is where the ovary twists around the ligaments that support it. It often involves the fallopian tube. It occurs on one side, similar to testicular torsion. Similar to testicular torsion, this is a rapid evac, and this can lead to like tissue death or loss of the ovary, which would be, we don't want that. Symptoms are going to be sharp, severe pelvic or lower abdominal pain, nausea and vomiting, tenderness in the ovary, fever, and possibly a mass. Um, and risk factors like previous torsion contributes to this, pregnancy, fertility treatments, or ovarian cysts, which are more common than we realize, and masses. Um, Something to really think about when it comes to like genitalia and like discussing these things with your clients when you're doing a patient assessment is like addressing the elephant in the room that like it is inherently awkward. Um, but like what they're telling you, number one, is like confidential. And then number two, like you're here for their care, you're here to help them, and like these things can be life-threatening. You don't want to like scare them in that, but like you also want to underline like the seriousness of this and like how much that this does matter and how for you to be the best guide that you can be and take care of them the best, that they need to give you like the good, bad, and ugly of what's going on and like the information that might be uncomfortable to share, but is necessary for you to make the right decision. And so that's also important. Okay, that was really long. Sorry that you had to watch all that. And I will make sure to add testicular torsion, um, ovarian torsion, and ectopic pregnancy. Um, yeah, those are the three topics I covered. I covered cold injury and hypothermia specifically, heat exhaustion specifically, and other heat illness, and then also abdominal illness and injury. Let me know if there's anything I need to add. Thanks so much. Sorry it's late.